OrphanCare was founded by Datuk Muhammad Adnan Muhammad Tahir in 2008 with the aim to give love, care and security of a family to children living in institutions and abandoned babies via baby hatches in Malaysia. Under the patronage of HRH Sultanah Hajah Kalsom, the Sultanah of Pahang, OrphanCare is managed by a chairman and a board of 6 trustees committed to this cause. Our mission is to transform the existing outdated and harmful system of institutionalization into one which supports and protects children by moving or reintegrating them back into safe and loving families. Our work entails the holistic process which includes adoption and reintegration, parenting and temporary care for mom and babies, social support services, counseling, awareness and advocacy. There are many reasons why children are placed in institutions today. Poverty, children born out of wedlock, family problems, and children with disabilities are some of the reasons why these children end up in institutions and are attended to by social workers. An estimated 8 million children worldwide today live in institutions that cannot meet their needs and are denied their rights. Even more alarming is that more than 90% of these children are actually not orphans. Institutionalization severely harms the health, development, and life chances of children. Global research shows that children living in institutions suffer lifelong physical and psychological harm. Children who spend a large part growing up in institutions tend to develop low self-esteem, which usually causes behavioral problems, delinquency, and poor academic performance. Babies suffer mental trauma and fail to develop positively, and it is even worse for children with disabilities. 26% of young children with disabilities have sadly died in institutions. Statistics also reveal that children who have lived in institutions are 500 times more likely than their peers to commit suicide, 40 times more likely to have criminal records as adults, and 10 times more likely to be involved in prostitution. The time to end institutionalization of children is now. Studies prove that there are many benefits in deinstitutionalization. Via deinstitutionalization, children raised in family-based care environments become more confident, less inhibited socially, mentally, and emotionally, and can eventually be part of a larger positive community. Working to end institutionalization is a journey we must all embrace together. The 5 elements of deinstitutionalization are: 1. Reintegration of children back to their biological parents. 2. Reintegration of children to their extended family. 3. Children being adopted. 4. Children being fostered. And 5. Children being placed in small group homes. This especially applies to disabled children. The journey towards deinstitutionalization and family-based care begins from the top, and policies must be influenced by informed decision-makers. Presently, most funds are allocated into the upgrade and maintenance of institutions over the development of community services. Community-based services provide higher quality care and are more cost-effective compared to institutions. In some countries, family-based care costs only 10% of institutional placement. Therefore, budgets should be reallocated. The legal framework to protect and provide services that these children need must be updated. Also, a well-trained and professional workforce is needed to ensure proper care and support for vulnerable children. Finally, effort must be focused on developing new systems of care and support to ensure a smooth transition of these children from institutions. Understanding the importance in solving this problem, the time to end institutionalization of children is now. Together, this is one form of child abuse we can eradicate in our lifetime. Embark and support the deinstitutionalization mission today by helping us spread awareness to the community.